Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Nigeria's COVID-19 death toll now exceeds 2,000 as samples tested edge past 1.6 million. And as more states begin sensitization of COVID-19 vaccination, Lagos State begins administration of 507,000 vaccines with health workers, government officials and the police prioritized. The World Health Organization says countries should not stop using the Oxford-AstraZeneca vaccine amid fears of adverse reactions. From the Nigeria Center for Disease Control (NCDC), 287 new cases were confirmed and 8 deaths recorded in Nigeria. So far, 2,001 deaths have been recorded in 36 states and the Federal Capital Territory since the virus first took hold. Till date, confirmed infections stand at almost 160,000, while over 142,000 cases have been discharged. The 287 new cases are reported from 17 states and the FCT, Lagos recording the highest, 107, followed by Kwara, 26 cases. Akwa Ibom recorded 23, Bauchi 22, Ogun 21, Rivers 19, Kaduna 14, the FCT 11, Abia 8, Edo recorded 8 as well, Ekiti 6, Kano 5, Gombe 4, Osun 4 as well, Oyo recorded 3 cases, Plateau 3, Nasarawa 2 and Delta 1 case. Meanwhile, more state governments continue to receive their share of the 3.94 million doses of the Covishield with patent right from Oxford-AstraZeneca vaccine facilitated by COVAX, a partnership between CEPI, Gavi, UNICEF and the WHO. The delivery is part of the first wave of arrivals in Nigeria, with more expected in the coming week. So far, about 28 states have been allocated a share of the vaccines. The Northwest Zone is fully accounted for, with all 7 states, followed by the North Central 6 states. Next is the Southwest, with 5 states which have received theirs, followed by the South-South with Akwa Ibom, Edo, Cross River and Delta State. 4 states have received theirs in the Southeast, and we have Bauchi, Borno, Taraba in the Northeast. Now, in terms of the zone which received the largest, thanks to Lagos, the epicenter of the pandemic, and its allocation of 507,000, the Southwest has a total of 858,310, with states in the Northwest second highest, with a total of over 700,000. The Southeast and Northeast are at the bottom, with a little over 200,000 doses received. Now, after their virtual meeting, members of the Nigeria Governors Forum pledged to publicly take the vaccines to encourage more people that the vaccines are safe. And in some states, healthcare workers were prioritized, followed by the politicians. Now, while a few more states are yet to receive their share, some states, like Adamawa State, which has gotten its share, 59,200 doses, other states that have received for example, Enugu, Gombe and Bayelsa, with the numbers of vaccines they've received still unknown. So far, it's almost 3 million that are allocated out of a total of 3.94 million doses of the Oxford-AstraZeneca received. Channels Television will continue to track how much vaccination is also taking place across the country. Now, Lagos State has rolled out its COVID-19 vaccination drive, with the state governor, Babajide Sanwo-Olu, receiving his jab after the state got its own share of the Oxford-AstraZeneca vaccines, marking the official rollout, distribution and administration of the vaccine across the state. The Commissioner for Health, Professor Akin Abayomi, who also received his jab, says the rollout will be in 4 phases, with priorities given to health workers, the police, airport authorities, judicial workers, among the first set of people to receive the vaccine. Now, for the phase 2, those 50 and above and others with underlying ailment will be vaccinated, while phase 3 and 4 is for those interested in being vaccinated. Professor Abayomi says that IDH, LASUTH, FMC Ebutemeta will be kicking off the vaccination, and 88 centers will also be designated on Monday. for the exercise.
There is an elaborate plan to roll out the vaccination in 4 phases. The first phase, or phase 1, will include all frontline workers, health professionals, staff at port health, air, land, and sea, members of the police, the military, all laboratory staff, the judiciary, and the COVID-19 rapid response teams. Phase 2, which will commence immediately after phase 1, will include anybody over the age of 50, as well as those living with what we describe as comorbidities, which are essentially hypertension, diabetes, or any other underlying condition that predisposes you to developing severe or critical COVID-19 disease.
Meanwhile, the Cross River State Government is also appealing to residents to take the COVID-19 vaccines and help tackle the spread of the pandemic in the state. The Director General of the state's Primary Healthcare Development Agency, Dr. Janet Ekpeong, gave the charge at the Lawrence Henshaw Memorial Hospital, Calabar, after administering the COVID-19 vaccines to some frontline workers. But she disclosed that so far there are no challenges faced by the state from administering the vaccines. The state government says it hopes to administer the vaccine to a majority of health workers in the coming weeks in the city and hinterlands, while increasing sensitization, which is ongoing.
We don't really have any challenge per se, but what we want to appeal is that there should be that high demand to take the vaccine, because the vaccines are available. Though for this first phase, we are only targeting health workers, but subsequently we will be targeting the people above 50 years old, and of course those with comorbidities, as well as the general public, because between this year and 2021 we are hoping that we can vaccinate about 70% of the entire population in Nigeria. So what we need right now, we need a high demand for this vaccine. We are ready, they are in the right they are being stored in the right temperature, they are potent, so make yourself available to take the vaccine, and let's see how we can end COVID-19 in Nigeria and in Cross River State.
In the meantime, the Imo State Governor, Hope Uzodimma, has enjoined all Imo State indigents to make themselves available to receive the Oxford AstraZeneca vaccine against COVID-19 in order to curb the spread in the state. The governor disclosed this at the headquarters of the Imo State Primary Healthcare Development Agency in the state capital during the flag-off of the COVID-19 vaccination program. While commending the federal government for their efforts in ensuring that Nigerians get vaccinated against the disease, he urged Imo indigents to discredit all rumors against the Oxford AstraZeneca vaccine. Now, Dr. Ajoke Adewale is a public health physician. She joins us via Zoom here in Lagos. Thank you for joining us on the program.
Thank you for having me. It's a pleasure to be here.
All right, great to have you. Are you looking forward to receiving the vaccine as Lagos State begins rollout today?
Yes, I'm definitely looking forward to it. It's a welcome development. And as a public health physician, I'm in the forefront. I'm one of those in the forefront of the fight against COVID-19. So this is a very, very welcome development. Yes.
For a lot of states, the state governments are taking the vaccines first. What they say is to give residents in their states a sort of confidence that the vaccines are safe. But to you, do you think that is the right step? For a few other states, they're prioritizing frontline workers, and then you have other states where, the politicians are taking the doses first. Do you think that gives people confidence and takes away the vaccine apathy or hesitancy?
Yes, I think that it's a very good strategy in the sense that, you're balancing good strategy with giving those who need it first. We don't have as many vaccines as we would like to have in Nigeria yet. We have just a few vaccines. So we're doing it in phases. And while this first phase is ongoing, we are preparing for other phases. Giving health workers, Lagos State is for the phase one. They're giving health workers, and they're also going to give strategic leaders. When in a community, people see that the Bale or the chairman of the local government has taken their vaccine, they are more invested in taking it. But when they don't see their own traditional heads or leaders taking the vaccine, they're going to feel there's something about it and they're going to shy away from it. So it's a very strategic decision to protect the health workers who are in contact with people with patients with COVID-19, to conserve the workforce and protect them, which makes a lot of sense, and also to give the leaders in the forefront. So you give the opinion leaders, you give the gatekeepers, you give those in the limelight, and everybody. And when people see that indeed they took the vaccine openly and there were no side effects and life continued, they would be inspired and definitely want to take the next phases of vaccines as they come into the community. So it's a good strategy, and it's going to work for a country like ours, where we look at our leaders most of us look at our leaders before we act.
But Dr. Adewale, what do you say to some health workers who are not necessarily convinced and taking the Oxford AstraZeneca vaccine? They're still hoping to receive some of the other vaccines.
What I would say is that taking the vaccine at this point is not a compulsory event. Although it is necessary and should be welcomed with open arms, nobody's going to force or shove the vaccine down anybody's throats. But as healthcare workers, even if we are not in the emergency rooms, we know that we are on the forefront. We are all frontline workers. You have people that are coming to the clinic to have a regular family planning procedure. Then they are symptomatic carriers of COVID-19. So we are doing this for our good. I'd like to encourage them. And while there's so much debate about the different types of vaccines, I would say that the AstraZeneca vaccine is very potent. I mean, it has a high level of efficacy. Apart from the fact that it's, according to research and what was done on it, it protects against mortality 100% from COVID-19. So that is to say, if you develop COVID-19 and you're taking the vaccine, you're likely not going to die from the vaccine. Before this vaccine was shipped, a lot of research has been done concerning it. And so I would just encourage them and say, look at the facts again, look at public health data. Many people are looking up to you. And apart from that, what's more important is your own health and your own life. I've personally lost a lot of colleagues to COVID-19. And if I, as a public health physician, I have done my due diligence and I see AstraZeneca is a good vaccine with good efficacy, with minimal side effects, 100% protection from mortality. That is, you may, by one stroke of chance or the other, still get COVID-19 after the vaccine, but you are likely not going to die from the virus after being vaccinated. So I'd encourage our health workers to look to science and take the right decisions for their health, for their families, and for the populace looking at them.
We appreciate your time on the program, Dr. Ajoke Adewale. Thank you for joining us on the program.
It's my pleasure.
Over in Edo State, the government says it will prioritize frontline healthcare workers and the elderly as the first set of persons to receive the Oxford AstraZeneca COVID-19 vaccines in the state. According to the Permanent Secretary in the state's Ministry of Health, Dr. Osamoyi Iroa, the personnel involved in the vaccination exercise have been trained and designated centers have been arranged in all 18 local government areas of the state.
Coronavirus affects all ages, and everyone is at risk of contracting this virus. However, healthcare workers, especially the frontline healthcare workers, have an additional job-related risk of getting infected. Hence, the administration of the vaccine to them is of top priority. Other groups with greater risk of the severe disease include the weak and elderly, people with chronic illnesses like diabetes, heart disease, hypertension, and people with conditions that lower the body's immunity.
According to the German health minister, Jens Spahn, there is no evidence of an increase in blood clots in connection with the Oxford AstraZeneca vaccine. Spahn's comments come after Denmark and several other European countries suspended the AstraZeneca vaccine's rollout over reports of people developing severe thrombosis after receiving a dose. This is also as coronavirus case numbers are rising again in Germany, prompting the head of the country's infectious disease center, the Robert Koch Institute, to announce that the third wave of the pandemic was underway. Stephen Beers, the Deutsche Welle correspondent in Berlin, joins us now for more on this. Hello, Stephen. What's the situation in Germany right now?
Well, the situation right now is that there were more than 12,000 new cases reported today on Friday, and that follows about 14,000 new cases across Germany on Thursday. Those numbers both higher than they have been in the past week, and that leads to concerns that there is indeed a third wave rising. That's what we're hearing from the head of the RKI, the Robert Koch Institute there. Especially concerning is that the number of infections amongst young people has increased a good bit, and that, of course, happening as the variants, especially this variant from the UK, has really taken over as being the real source of a lot of these new infections. So there's some new dynamics at play that are cause for concern, and that's what's being kept an eye on. Here, it's been expected for a while, in fact, that the new variants would take over and that we would see something like a third wave. But of course, there was hope that with the vaccination progress, that could be blunted a little bit.
Vaccinations help blunt the rising infections. And what can you tell us about the concerns of the AstraZeneca vaccination, which was halted in Denmark and a few other countries yesterday?
That remains the question, whether those vaccinations really will arrive in time. The short answer appears to be no. Right now, Germany appears to have mostly secured those in the age above 80. That is the most vulnerable population. That will go a long ways in helping reduce hospitalizations. But otherwise, the vaccination rates have been pretty low here because the rollout has been so slow. A lot of that has hinged, in fact, upon the AstraZeneca the AstraZeneca vaccine. That's been one of the main vaccines that has been readily available for Germany, but we've seen slow pickup from a lot of people just because there's been some doubts about the efficacy of the vaccine. Of course, those clinical trials showing early on that the efficacy rate of the AstraZeneca was lower in comparison to some other vaccines, but it was still over time proven to be has been shown to be much more effective than originally thought. Still, there is that reticence. What's a concern right now is that we're seeing that some countries, as of yesterday, have begun suspending use of the AstraZeneca vaccine, citing some blood clots that have appeared amongst some patients. Those numbers appear to be very, very low. For example, in Denmark, there was one patient who died, a 60-year-old woman, after receiving the shot. She died from a blood clot, and they suspended use of the AstraZeneca based on that. It's a question of whether it relates to one batch or the vaccine in general. But of course, if we look at the UK, if we look over there, we see that it's the predominant vaccine. I believe more than 10 million of the jabs used over there, and there's been no signs of major medical issues, but still just that specter of safety concerns over the AstraZeneca that could further hamper vaccination rates here. And then, of course, that's on top of supply issues. AstraZeneca, Moderna, both supplying much less of the drug than they have been contracted to actually supply, and that's a real concern.
Finally, Steve, just before we let you go, what's the mood in the country given the rising cases and then, on the other hand, the slow rate of vaccination?
The mood is tricky here because there is that concern that we are approaching a third wave as vaccination isn't as far as it should be. And of course, many Germans can look across the sea to look across the Atlantic to the U.S., where they see a much faster vaccination rate. And they may have seen that U.S. President Joe Biden mentioned just yesterday that by July 4th, they hope to be able to celebrate something of a normal holiday. July 4th being, of course, Independence Day in the U.S., a time of gatherings, cookouts, things like that. Here in Berlin, Germans would love to be able to believe that they could do the same thing, that there will be a summer sort of break, that they will be allowed, that things will free up at that point. But it's really hard to see, given the rate of vaccinations and the specter of a looming third wave, if that will be the case. Of course, there is hope that with warmer temperatures, much like last year, vaccination, or rather the incidence rate really falls, and that with vaccinations rising in the second quarter, which is when more of these vaccine supplies are supposed to be there, that those two currents will sort of work together to make for something of a normal summer. But we really don't know, given that there is a predominance now of these variants and that the dynamic seems to be a little bit shifting because of that. It will remain to be seen how the summer goes, and then the real test will be whether things are really sort of in the bag by fall.
Oh, many thanks, Stephen Beersley there, Deutsche Welle correspondent. Thank you for your thoughts on that. Now, the World Health Organization says there's no reason to stop using the Oxford AstraZeneca COVID-19 vaccine after several European countries suspended the rollout over the blood clot fears. The WHO says its Vaccines Advisory Committee was currently looking at safety data and stressed that no causal link had been established between the vaccine and clotting. Here's more on our global update.
Around 5 million people in Europe have already received the Oxford AstraZeneca vaccine. There's been about 30 cases in Europe of developing blood clots after the vaccine was administered. Several countries, including Bulgaria, Thailand, Norway and Denmark, have suspended the use of the vaccine. AstraZeneca has said the drug's safety has been studied extensively in clinical trials. And while the World Health Organization says its advisory committee is investigating the AstraZeneca vaccine issues, the UN agency insists there is no reason not to use it.
It's very important to understand that, yes, we should continue using the AstraZeneca vaccine. All that we're looking at is what we always look at. Any safety signal must be investigated. In fact, it's very important that we're hearing safety signals, because if we were not hearing about any safety signals, then that would suggest that there is not enough review and vigilance. We must always ensure we look for any safety signals when we roll out vaccines, and we must review them. But there is no indication that to not use it.
In other developments, Nagpur in western India is to be the first major city in the country to return to a complete lockdown amid a sharp spike in coronavirus cases. The week-long lockdown, which starts on March the 15th, will extend to adjoining areas of the district as well. India has recorded more than 11 million cases and 157,000 deaths so far. Italy has recorded a daily increase of more than 25,000 COVID-19 cases for the first time since November the 29th last year. Meanwhile, officials in northern Italy have confirmed that the situation has worsened and the regions will soon be declared red zones, which means the highest level of coronavirus response. Elsewhere in Europe, Germany's health minister says Germans have to brace for a few hard weeks with the onset of a third wave. Experts say vaccination would help bring the virus under control, but in the meantime, people should socially distance. And finally, some positive news. All remaining restrictions in New Zealand's largest city, Auckland, have been lifted after no locally transmitted cases of coronavirus were reported for 2 weeks.
This follows 6 days of Auckland being at alert level 2, with 7 days prior to that at alert level 3. The increase in alert levels was, of course, due to the Auckland February cluster, 15 positive community cases outside managed isolation facilities. All of those 15 cases are either in a quarantine facility or have recovered. The Director General of Health has advised Cabinet he considers the outbreak to be contained.
Swift public health measures combined with aggressive contact tracing, border closures and compulsory isolation for travellers have been credited with making New Zealand highly successful in keeping the pandemic from spreading.
And for that we all say thank you.
And just before we go, back in Nigeria, former head of state General Abdulsalami Abubakar and his wife joined the list of those who have been vaccinated in the country. He received his Oxford AstraZeneca jab today in his country home, Minna, the Niger state capital. Continue to take responsibility and remember, it does not matter if you've taken the vaccine, you still need to adhere to the non-pharmaceutical interventions and other public health guidelines. Visit our website, it's channelstv.com for more updates, a better understanding of the pandemic and several other stories. That's our program for the week. Thank you for watching. I'm Millicent Walker.